there are things that we can do to inhibit the growth of cancer cells that can be done for a very long time after the appearance of cancer. Like, for example, hormone manipulations, such as we're now discussing. We originally, when we started doing it with tamoxifen, we did it for a year, did very little. We did it for 2 years, and we started seeing an impact. Did it for longer, now up to 5 years in the tamoxifen period, and we got a bigger impact. And then the use of these new drugs that are aromatase inhibitors, or AIs, of which Femara is one, has been shown that 5 years after the 5 years of tamoxifen was beneficial. Now, a lot of this research is really still evolving, and we have people here who actually have been involved in all aspects of this in terms of the biology and in terms of some of the very early work really on tamoxifen. And what I'd like them to address, Marc Lippman, is the, if we get a mic over here, is speculation about, please, right over here, raise your hands so they know who you are. Because Marc is the one who introduced me, in fact, to the to the field of hormone manipulation of cancer, and speculation on this concept of prolonged anti-estrogen or estrogen-directed therapy as a preventative for recurrence.
Thank you, Larry. What we know for sure is that breast cancer can be a very cruel disease, and that women 15, 20, and 25 years after cessation of their therapy can recur. So what that means is, for sure, is that some breast cancer cells have squirreled themselves away and are sitting either in these niches that we've heard about or just semi-minding their own business, and somehow they get able to grow again. So if that's true, and some cancer cells can survive that long, then certainly a therapy that was completely safe that could suppress something, keeping a faucet turned off, would be totally reasonable. And therefore, it's logical to say, why not just continue tamoxifen or one of these aromatase inhibitors for 5, 10, 15, 20 years? The problem is that they aren't necessarily completely safe. And of course, it's also true that a woman who has survived 10 years past her original diagnosis may be in that very happy setting of being cured. And then taking a pill can only harm her. So it's tricky to know. It's tricky to know. The studies that have looked at 10 years of tamoxifen versus 5, I think the most honest statement would be that they are equivocal in different people's minds. In the sense that people tend to go on both sides who are pretty expert. Right-minded people disagree about this. Some very fancy people who won a big award from Breast Cancer Research Foundation are convinced that 10 years is good. I'm not pointing to Larry here. And others don't think so. For the aromatase inhibitors, clearly, they can have effects on bone demineralization. They clearly can elevate cholesterol. And they may or may not, eventually, with long-term use, have adverse effects that we can't anticipate. There are wonderful studies ongoing now looking at 5 versus 10 years of aromatase inhibitors. Courageous women, just like the women who participated in other trials, are doing that as well. Jim Ingle, who's here, also one of my children from the Mayo Clinic, is actually, I think, leading one of these studies and might wish to comment.
I'll just comment that endocrine therapy is very, very important for the majority of women with breast cancer, because the majority of women have an estrogen receptor. With respect to the duration of therapy, a number of very courageous women participated in a placebo-controlled study beginning in the late 1990s. Well, in 2003, it was clearly shown that women who had had 5 years of tamoxifen, who were postmenopausal, and then took 5 years of letrozole, which is Femara, did much better. Now, the question is duration. There are ongoing studies now that are looking at whether longer is better and whether it's safe to give. So much promise for using these treatments. Now, I'll say one thing about toxicities. We're becoming much smarter about how to deal with some of these toxicities, but we're learning from the prospective studies.